Hi, my name is Victor, and today I want to talk to you about technology. Some excellent technology that has been available for, as far as I know, well over a decade. And in my opinion, what was once upon a time science fiction is now science fact. And by that I mean tumors or cancers in various places of the human body can be treated, killed, and destroyed without surgery. That is, without being cut open. Cancers or tumors in the lung, that's right, the lung, the breast, the spine, the brain, or the prostate can be destroyed without or with very minimal side effects and very little downtime, if any, if there's any downtime. I know because it has happened to me, and that's why I'm talking about this. And that technology I'm talking about is called the CyberKnife. It is located in various medical facilities throughout the country. Not all medical facilities will have a CyberKnife. If you are fortunate enough to be close to a medical facility that has a CyberKnife, then again, I think you should consider yourself lucky or blessed. I was fortunate in that I was found to have prostate cancer. Prostate cancer is a very, very disabling, or prostate removal surgery is very painful surgery for a man to go through. Based on what I was told by the medical professionals and by family members that have experience with this. And it was something that I sorely wanted to avoid. And I did some research in 2007. And I was fortunate enough to find the CyberKnife in Concord, North Carolina. The medical facility that is less than 20 miles away from me is Carolina's Medical Center, 920 Church Street North. There we are. It's Carolina's Medical Center, 920 Church Street North, Concord, North Carolina. The phone number is 704-403-1577 or 800-575-1275. Now, I'm trying to give the CyberKnife as much positive press as I can because of what it has done for me. And in this during this presentation, you will see two other patients that have been through the CyberKnife. Both of them women. One had breast cancer that had metastasized to another part of her body. Another one had a growth along her spine. And they were both able to avoid surgery. And they were successfully treated by the CyberKnife. Okay, and now we're going to get on to the other patient stories about the CyberKnife. You will see that their stories are very similar to mine.
I was afraid that I would not see our children grow up, get married, have grandchildren. I mean, just think about things that you just take for granted every day. I just kept, going back to the fact that this can't be happening. And after they diagnosed me, I had a lumpectomy and a mastectomy. The hope was that she was cancer-free and cured, and she remained without evidence of any cancer recurrence until December of 2008. And as we often discuss with cancer, different cancers have different time course over which they have a risk of recurrence. Some cancers, if they are going to recur very quickly. Other cancers, such as breast cancer, prostate cancer, we're very hesitant to use the word cure with those patients until at least 15 years or more following the diagnosis. So unfortunately, Mrs. Stewart had been approximately 14 years since her diagnosis when she presented with chest pain. I was at work and I was feeling some pain in my chest and in my arm, tingling and all that. And of course, after reading everything, you just think like, oh my goodness, it's a heart attack. So I called my doctor and she set up all the tests and things. And that's when we found out that I had metastatic breast cancer on my sternum. So again, was like reliving the past years, but this time I'm thinking, my number's really up now.
So when she was initially diagnosed with her recurrence, she began chemotherapy under the direction of Dr. Generosa Grana here at Cooper, in the hope to not only treat the cancer that was detected, but also potentially eradicate any other cells prior to detection that could be present.
Okay, so at this point she's discovered that she has metastatic breast cancer, and they decided to treat her with chemotherapy.
When we first went over the first treatment plan, it was to get chemotherapy. And I did get that, and I tolerated it well, and then the cancer went away. And then 7 months later, it came back again. So then Dr. Grana said it was going to have to be more aggressive. So we decided on chemo again, and she suggested that we do the CyberKnife. I have heard of CyberKnife, and I've seen it on TV, but I didn't think that I would ever be one to utilize it. And after seeing Dr. LaCouture, and she explained it, and they took me around to see the facilities, which are incredible.
CyberKnife treatment is a modified linear accelerator, as you can see behind me. The way that CyberKnife works is delivering multiple pencil-thin beams of radiation, often from more than 50 to 100 directions, depending upon the tumor type, all of which meet at one focal point to deliver very high dose to that area, but with each individual beam delivering only a small amount of dose to the normal surrounding tissue as it gets to where it needs to go.
My treatment was about 90 minutes each time, and of course it's a very soft bed, and they put your vest on you, and they play the great music, and this little robot, or big robot, just comes around, and you see, it's almost like a Star Wars thing, because you see all these beams shooting all over the place.
Mrs. Stewart's only persistent lesion identified on PET scan was in the upper section of her sternum, the breastbone in the center of the chest. We then developed a treatment plan for her that allowed us to deliver 3 CyberKnife treatments, delivering approximately 8.5 units per treatment, that overall, when we look at the comparative dose, it allowed us to finish what would have been the equivalent of nearly 5 weeks or more of radiation over the course of 3 days.
After 90 minutes, you were out of there. You were totally out of there, and you were...
So her treatment was 3 days over 90 minutes. 90 minutes for 3 days consecutively. And that's absolutely phenomenal. And the point I want to make sure that everyone understands is that after she first went through chemo, the cancer came back, and then they decided to get what they called more aggressive, and they decided to use the CyberKnife along with some chemo as well.
Free to do whatever you wanted, and I left here with feeling uplifted. I never at all felt like I was getting any kind of serious treatment. Some of the tests are worse than getting a CyberKnife, and I was coming out of there like there's something seriously wrong with me. I don't feel like anything's happening. They're playing great music for me. I'm singing on the turnpike going home, so it was a very great, really good experience.
Mrs. Stewart, at this point, thankfully, is doing well. She has a wonderful quality of life and a wonderful outlook on life. At this juncture, she has no evidence of abnormalities on her PET scans. However, we will follow her very carefully so that if she were to develop an additional problem, we're right there to try and offer her whatever the most appropriate option would be.
It's unfortunate that I have cancer, but it's very fortunate that I have Cooper, because it's a family type. Even my regular doctor is from Cooper. So, I mean, I'm so fortunate to have them.
Okay, here's the next patient's story. Her cancer was in her spine, I believe.
My C3C4 vertebra. A chordoma is a rather rare tumor. They don't know what causes it, and it's generally malignant. It can metastasize, and also it has a tendency to wear away the bone. And one of the things that makes it so bad is not just the fact that it's cancer, but where it is. So my particular tumor was wrapped around my vertebral artery. So even more than cancer, the issue was having a stroke at a very young age. I was that I had this. Not really at an age when I was expecting to have cancer. Well, I actually really feel like grad school took a bigger toll on me than cancer. And that says a lot for CyberKnife. I think that my experience with cancer was so much easier and so much less traumatic because of CyberKnife than so many other people that I have talked with. My husband and I had named my chordoma Jerry. So Jerry was now under attack. My job, even though I'm a teacher, you might not think it's the most active job, it requires me to be very active, just short of singing and dancing. And you know, it works. All my stuff works, which is good because it didn't work before, and it used to hurt, and now I don't hurt. I asked my doctor about what would have happened if I hadn't had CyberKnife. And what he told me is that what he would have done surgically was to remove 2 of my vertebrae, just completely remove them, build a cage, plant a bit of bone because bone grows, and then they would have had to grow back. That is traumatic surgery. To be honest, my experience was actually kind of cool. I mean, I had one of the truly cool treatments, and it worked, and I think things could have been a lot worse, especially had they gone with surgical resection. Can you imagine your spine? When I found out about my cancer, I was, at the time, studying to be a commercial pilot. My diagnosis changed all of that because to be a pilot, you have to have your medical. You have to have a Class A medical. And with the threat of stroke and cancer hovering over my head, there was just no way I was going to be able to get a Class A medical. If I had known that CyberKnife would be so successful and that it would be so non-invasive and so not traumatic, I might have continued down that path. Had there been surgery, completely out of the question. The years that it would have taken for me to basically grow my spine back, and I mean, I might be on disability. As it is, I think things turned out for the best. I'm in a field that I love, and I feel like I'm actually a lot better off than I would have been before. The people at Georgetown with the CyberKnife, first of all, they were really interested in what they were doing, and I always feel better when people are interested in what they're doing. And second, they were all so nice. So for 5 days, I did that. I was tired, I'm not gonna lie. I don't know if it was because it all happened so fast. A lot of it was psychological. That was probably the only side effect I really had at the time was fatigue. I think that one of the greatest blessings that I got from CyberKnife is that I don't live like a person who survived cancer. I just live.
Now, to address one item that she brought up was the surgery. In her case, her surgery would have been very, very traumatic, and like she said, she probably would have been on disability in order to recover from the surgery, because the surgery, in fact, by itself is in fact an injury to the body. So she would have had to be on disability in order to recover from the surgery, and that was one of the main reasons that I decided to go with CyberKnife rather than having prostate removal surgery, because prostate removal surgery for a man is very, very traumatic. It's like being instantly hit with a horrible disease. All right. In this particular screen, I'm going to demonstrate how to find a CyberKnife location. If you should come upon a situation where you think you may need the use of a CyberKnife, there's a way to go about looking for one. And the easiest way I found is to go to cyberknife.com, which is where I'm located on this website, and click on CyberKnife locations. And then there's a drop down for product. Select CyberKnife. Country by default, in my case, is USA. And what I will do is select the state that I'm in. And no, I won't select the state, I'm sorry. First, I'll just type in my zip code. And my maximum distance that I'm willing to look. And I'll click 25 miles. So I'm looking for a CyberKnife that is in the USA within 25 miles of zip code 28227. And I click on search. And there it is. That is the very facility that treated me in 2007. Carolinas Medical Center, 920 Church Street North, Concord, North Carolina, 28025. There's a phone number, and there's the URL for their website. And the distance, in my case, was 17.35 miles. Okay, thank you for watching, and that is the end of, that's all the CyberKnife stories that I wanted to share. But before I go, I would like to repeat myself as far as the location of the CyberKnife here in Charlotte, North Carolina, or close to Charlotte, North Carolina, in Concord, North Carolina. The phone number is 704-403-1577 or 800-575-1275. And once again, the CyberKnife is in fact, as you've seen, a tool that saves lives and helps a person maintain the quality of their life. Kills cancers or tumors without cutting the person open, that is, without surgery. Thank you for watching. Bye.